A big welcome and thank you very much for everyone who's joining us today. I'm Claire from Supreme Pet Foods. We're bringing you this webinar today on guinea pig nutrition. Before we start, I just wanted to share a little video with you all about Supreme Pet Foods. Okay, so thanks for watching that. I'm very pleased that Molly is joining us today to give this talk on guinea pig nutrition. We've been working with Molly for probably 15 plus years now, and I'd like to think in that time we've done a lot of work to try and help raise people's knowledge about small pet care and nutrition. And I think it's really interesting that we're focusing on guinea pigs at the moment, because with the pandemic, we've reportedly seen a huge increase in many pets, but guinea pigs are reported to have as much as doubled in terms of pet ownership. So I think it's really important that we're making sure these pets are fed properly. So without further ado, Molly, thank you very much. Over to you.
Thank you, Claire. Right, desktop. Right, so here we go. We're today going to talk about guinea pigs, and we talk a lot about rabbits, we talk a lot about dogs and cats, and sadly quite a lot of the time there's a little, it's just a guinea pig or it's just a hamster. And actually what I really wanted to do today was to look into guinea pigs in a scientific way, look into actually what they specifically need, and then also look into feeding them appropriately for some of the very common clinical conditions that we see in these animals. And it's interesting, once you start to look into guinea pigs, they used to be used very, very regularly as a laboratory animal, and their use is actually declining significantly. And we are certainly much more weighted now to guinea pigs as pets. And as much as rabbits are a very popular small pet in the UK, guinea pigs are actually the 7th most common pet kept in the UK. And in my practice, I'm certainly finding that we are seeing a lot more guinea pigs, and a lot more guinea pigs with adult owners, a lot more guinea pigs that are insured, and actually a lot more owners with very significant and high expectations for their feeding, their nutrition and their care. And many vets, like myself, will get, if they're lucky, half a day at the most on guinea pigs at university. So there's a lot for us to learn. I mean, obviously there are some very good exceptions to that, but a lot of us don't get taught very much about these guys whatsoever. So what are we actually going to look at and talk about today? Actually, what do wild guinea pigs eat? What do they really need within their diet? And let's have a look at the gut function, because there is a little bit of an assumption, and there are some incorrect sort of things in places like Wikipedia. And the gut function is not the same as the rabbit, it is different, and they've used a slightly different strategy to cope with a similar sort of environmental requirement. And what this translates into is actually, how do we feed a pet guinea pig? And then let's have a look at the importance of some of the components of the diet in terms of that animal's health and its well. We'll look at hay, we'll certainly look at pellets, and we'll look at vegetables. And then again, we will look at feeding for pregnancy and lactation, and as I say, common clinical problems that are affected significantly by the diet. So in the wild, so it's important to recognise, to start with, that the domestic guinea pig or cavy is not the exact same animal that we see out in the wild. They're derived from animals that live high up in the Andes, and in that situation, actually, they're common food source. They're very commonly used in religious festivals, and as I say, for eating, for those sort of indigenous people that potentially are not farming or cultivating as much perhaps as other communities. And what this means to us, and why it's relevant to us to know this, is actually guinea pigs are used to a very high altitude and a very dry and arid and not necessarily particularly warm environment, and that impacts on how we keep the guinea pig in the home. They can get heat stress, and they do not do well with heat plus high humidity. Guinea pigs are actually fairly closely related to a lot of other relatively common pets like chinchillas and dagoes. They're reasonably closely related to capybaras and other things such as agoutis. Guinea pigs, similar to a lot of our small pocket pets, are completely herbivorous. They do, however, eat their own placentas. So that would be the one exception to that rule. But in the general course of things, that doesn't impact their dietary requirements. That is a very ingrained, instinctive behaviour for female guinea pigs. So in the wild, their natural diet is actually things like grasses and leaves, and occasionally crop plants if they're in that kind of an area. And they actively choose plants actually with a very high fibre content. And in the location where they're naturally found, there are very few succulent items available. You might get a few cacti and things like that, but in general, they don't have the fruits and sweet veg like peppers or carrots or anything like that. So that is the first lesson that we need to really learn about guinea pigs, is actually they are really truly herbivorous, and they really do need a high fibre content. And one of the consequences of that, and we'll come back to this later on, is that they don't deal well with the succulent items, and particularly the sugar in the succulent items. Guinea pigs are coprophagic, and I will come back to this again slightly later. They do produce two types of feces, but it is, as I say, in a different way than the rabbit. And guinea pigs quite famously have an absolute requirement for vitamin C in the diet. So they lack the enzyme, the L-gulonolactone, that preforms ascorbic acid within the body. So they have to take it in the diet. And one of the things that I think is very useful to consider to us as clinicians, so vets and nurses, is that quite commonly, when we see these guinea pigs that are not quite right, not okay, not really sure what's going on, quite often these guinea pigs have a little bit of a subclinical lack of vitamin C. So again, I'll mention that again a little bit later on. So I think the first thing that we need to myth bust a little bit is that we need to sort of compare and contrast the guinea pig a bit with the rabbit. And are they thecotrophic? Are they coprophagic? We'll go through this and then we can sort of decide really. So one of the things that guinea pigs are similar to rabbits in is that their strategy for coping with a high fibre diet is to ferment it in the hindgut, in contrast to things like sheep and goats and cattle, where they're foregut fermenters. Guinea pigs can be quite fastidious eaters, and it is very, very, very important if you have young guinea pigs that you expose the very young guinea pigs, so the 4, 5, 6 week old guinea pigs, to a wide variety of foods, because that really will expand the range of what they'll be willing to eat. And it certainly matters quite significantly when these animals then become ill in later years. So guinea pigs have cecal fermentation. This bit is very similar to the rabbit, although their cecum actually is potentially a bigger proportion of their gut than it is in the rabbit. They produce a different essential fatty acid as their main energy substrate. And instead of things like butyrate, guinea pigs actually are primarily dependent on propionic acid. And this is their primary energy substrate. Guinea pigs do eat their own feces, and I'm calling it coprophagic because, as I say, it's a little bit more difficult to discern normal hard feces versus cecotrophs in these animals. And the mechanism of the production of the cecal feces is actually quite different. In the rabbit, we have almost like an elevator system that brings all of the potentially digestible matter back into the cecum for fermentation. This physical system doesn't happen and doesn't exist in the guinea pig. So what we have in the guinea pig is almost like a groove in the large intestine that contains mucus, and this mucus traps potentially digestible particles and is expelled back into the cecum. So mucus trap sort of strategy rather than the washback that we have in rabbits. And actually, in a similar way to rabbits, there does have to be a way of sorting the gut contents into sort of potentially digestible nutritional portions, and those bits that are really hard to digest. And as I say, the colonic separation mechanism is the key difference between these two species. Now, this system that the guinea pig has is potentially less efficient than the rabbit, and that means that the separation is less specific, if you like. However, guinea pigs, as I said earlier, do instinctively choose a higher fibre diet, and while the separation mechanism is potentially less efficient, their overall digestive capacity is actually quite a lot better than the rabbit. They are less selective in many ways. Having said, they can be fastidious in terms of the variety of levels of fibre. They're certainly less selective than rabbits, and they can certainly eat a larger volume per body weight than the rabbit can. And I think this again is impacted by the lifestyle of the guinea pig. Rabbits are made to be able to run away. So in terms of part of their life cycle and part of their lifestyle, if you like, rabbits need to be able to have, at some times during a 24-hour period, a time where the gut is not as full and they can run and they've got less weight. Guinea pigs don't do that. They're certainly not built for speed. So they are then much more able to have a larger gut volume. And as I say, that allows them then to thrive on a higher fibre diet. So guinea pigs do produce two types of feces. You will occasionally see guinea pigs eat what we assume to be cecal feces straight from their back end. And sometimes you will certainly see guinea pigs eat each other's feces. And at work, one of the things that we're very lucky to be able to do is to be able to sit and watch our patients quite closely. And one of the things that we find quite interesting is that, you know, sometimes you will see, as I say, what appear to be cecotropes being eaten. Sometimes you don't see that at all. And what is very interesting is it's actually very difficult to distinguish visually between the feces that contain the non-digestible fibre and the feces that contain digestible fibre. And this is partially because towards the end of the colon, again, in contrast to the rabbit where there's a variable sort of influx and removal of water, in the guinea pig colon, as feces are transported distally towards the rectum, there will be a net removal of water. So a lot of the feces do appear quite similar. So what are their nutritional requirements? Again, at least 12 to 16% fibre in the diet, between 18 and 20% crude protein, and certainly 10 to 30 milligrams per kilogram of vitamin C daily. And generally the received wisdom is that for a healthy adult guinea pig, you need the lower end of that range. And for a guinea pig that's under metabolic stress, so for example, things like pregnancy, lactation or significant illness, then you would potentially want to increase that level of vitamin C daily. One interesting thing, and again, this is going to become relevant later, is that they have a very, very variable water intake. And this can vary, as you can see, between about 7.5 mils per 100 grams of guinea pig to about 40 mils per 100 gram of guinea pig, which is actually significantly more than a dog or a cat or a rabbit, where you're looking at around 100 mils per kilo. So again, they have quite a high water requirement, and that is certainly something that we need to be aware of as clinicians. Approximately, most guinea pigs will eat around and about 6 grams per 100 grams of body weight in food daily, approximately. I think it's worthwhile at this point highlighting the fact that, as I said earlier, we know a lot about guinea pigs because we've used them as research models for a very long period of time. But when you look into research on guinea pigs themselves, then there is a lot less out there compared to other more commonly treated species. And again, hopefully the tide is starting to turn. And one of the things, and again, I would like to highlight articles or papers like the one here. And this is really looking at the effects of diet on the anatomy and physiology and health in general of the guinea pig, and there are a lot of positive correlations. And I'm very happy to highlight that Argo, who is the first author on that paper years ago, was one of my vet students. So it's really, really good to see that people are coming up and actually looking at guinea pigs in a far more scientific way, rather than, you know, perhaps saying it's just a guinea pig. So what does this all mean for the pet guinea pig? As I said, dietary preferences are set early, and if you have any opportunity to impact that with your clients bringing home the new guinea pig and bringing it in for a health check, certainly do, because it can be a lot more difficult to expand their horizons and encourage them to eat different things slightly later in life. And again, we do find that a lot of owners are a little bit wary of feeding a wide variety of things. They know what works and they like to stick to it. However, the bigger your variety, the more likely you are to be able to get this animal to eat at least something if we're having problems later on in life. So very similar to rabbits, what we ideally are looking to do is to offer ad lib hay, a small amount of a good quality, absolutely guinea pig specific pellet that has been properly stored, and then a handful of leafy greens, fibrous leafy greens every day. So I would like to just come back to the guinea pig specific pellet comment. So guinea pigs have an absolute requirement for vitamin C. None of the other pocket pets do. So it would not be appropriate to feed a guinea pig, for example, on rabbit food or hamster food or anything like that. So they need their vitamin C, and guinea pig specific pellets have vitamin C included in them. Now, properly stored, again, that is a key factor, dependent on the pellets and dependent on the formulation. Some pellets have synthetic vitamin C, and that lasts however long. Other foods perhaps have non-synthetic vitamin C, and there is a distinct shelf life. So it is very worthwhile making certain that you understand that, and it's a really worthwhile area for troubleshooting. For example, if you have an owner that's getting a 15-kilo sack of pellets and keeping them for 6, 8, 10 months, that vitamin C content, whether it's synthetic or not, is unlikely to be as good as it was when the pack was first opened. So it really, really is worthwhile sort of doing that. Always my preference with guinea pigs is to avoid the commercial treats. So the things like the yogurt drops. I mean, seriously, guinea pigs don't eat yogurt. They don't eat chocolate. That is something that has been, marketed to play on us as pet owners. The guinea pig is absolutely thrilled if you give it a dandelion leaf, and actually they see treats as a communication with you, and we see treats as things, that are potentially sort of slightly damaging to us, like chocolate or sweets or something like that. So I really do urge owners to try and avoid the commercial treats and look at things that are far more appropriate, and really to avoid the sugary things as much as possible. And I'm also very careful with them with fresh fruit. So, the occasional raspberry or something like that, not going to be a problem, but 3 or 4 strawberries at the end of lunch every day will be a problem for a guinea pig eventually. The other thing to consider is the use of mineral blocks. And again, I wouldn't use mineral blocks with guinea pigs unless there is a specific reason to do so. And there are a couple of factors that I'm looking at in terms of why I'm saying this. Firstly, we need the food, and guinea pigs can be sensitive to that. If we give a lot of calcium to guinea pigs, then we will predispose them to urolithiasis. We also need to be careful with some of the other minerals. And again, guinea pigs are necessarily the same as species. I would also like to just draw your attention to the resources on the Pet Food Manufacturers Association website. Here you have the guinea pig sizeometer, and this is a really good resource for assessing the body condition of a guinea pig. And in the same way that I always try and assess body condition in rabbits, we do the same with our guinea pigs. And weight versus body condition is something that we note down for every clinical examination. So go ahead and have a look at the PFMA website, because there is some useful stuff on there over, you know, a few species actually. So obviously we've mentioned that hay is massively important, and guinea pigs, as I said, can process a higher fibre diet than rabbits because of, you know, it is an adaptation and a strategy to survive in the conditions that they found themselves in South America. So we should try as much as we can to sort of replicate this. And so, as I say, ad lib hay, they play in it, they eat it, they can search for pellets in it. And, you know, in a lot of situations, we see a lot of guinea pigs that are not offered sufficient hay. And just like with rabbits, there's, you know, potentially a fair amount of owners that don't realise that hay is not just bedding for these animals. So I do think that we should, again, when we're seeing these guinea pigs, highlight hay should be provided. The difficulty that we do get into is where we have guinea pigs that are just fed pellets at the pet shop, and potentially then sent out into the home with less than ideal advice, and they've never really learnt to eat hay. And again, that can cause us significant issues in terms of the teeth and things like that. Other things that we can sort of look at in terms of hay are the types of hay that we feed. And just the same as with rabbits, we don't want to feed a hay that is too high in calcium as their only source of hay. So alfalfa hay and clover hay can be very high in calcium. And this is not to say that they shouldn't be fed at all, but they shouldn't be used as the only source of hay. They are actually very common and very useful for components of pellets. And as part of a balanced diet, they're more than appropriate. But again, it is that understanding that you shouldn't be feeding alfalfa and clover alone. Now, one of the things that we always talk about in terms of guinea pigs, and certainly with rabbits as well, is the use of hay to wear the teeth down. And we'll come to the teeth again fairly shortly. And one of the things that I wanted to highlight, and again, it's quite interesting, is that hay, but also things like kale, grasses, other types of leaves, contain internal, what we call phytoliths. And what that is actually structures of silica and other minerals. And these are actually what the key to dental wear are held by. You know, the phytoliths in the hay and the grasses are what will wear the teeth down. And I've put a reference in here, and this is a reference to looking at wear on teeth with diets of different abrasiveness. And Muller et al. Did some work on guinea pigs, and they also did a very similar study on rabbits. And they had fairly similar results. So they had a diet of hay, they had a diet of hay and bamboo, they had a diet that had added sand, for example. And what they found is that the diets with the highest abrasiveness, so the diets with the added sand, had the guinea pigs having the most issue with their teeth. So it's not necessarily simply the abrasiveness of the diets that is important. It is actually the internal abrasiveness of the diet. So, as I say, the phytoliths or the phytosilicates, that will wear the teeth a lot more normally. And actually in the wild, if you think about what's available in the spring compared to what's available in the autumn or the winter, there are different fibre levels, but actually the internal silicate levels remain fairly similar. And there is more at play than just the abrasiveness of the diet in terms of tooth wear. So vegetables, and again, I would really like to encourage people to feed a variety of vegetables. Obviously, what we don't want is what's shown here. So peppers and tomatoes, these shouldn't be a massive part of the guinea pig diet. And I would encourage people to really prioritise the fibrous leafy greens. So it takes a little bit of work to chew these, a little bit of work to process them, to be able to swallow them. And again, there is a lot more in these in terms of vitamins and minerals compared to things like lettuce or, you know, tomatoes or what have you. I also actually do advocate the use of things like culinary herbs, things like mint and what have you, because those can be very, very good appetite stimulants for those guinea pigs that are not very willing to eat if they're unwell. You can, to a degree, use things like peppers and tomato and cucumber. However, these should be treats. If you have a guinea pig that is perhaps older and struggling with its water intake, for example, then cucumber can be used specifically, you know, as something that's high in liquid to encourage water flow through the body. But again, it's a specific use rather than necessarily a staple. And the upside of, you know, a small amount of fresh greens every day is that it gives your guinea pig something to do. It improves its time budget. It's not sitting there eating a bowl of pellets and then, you know, having 23.5 hours to do nothing in. But it is also a really good supply of vitamin C as well. Now, a lot of my owners these days are getting into foraging. So rabbit owners, guinea pig owners, very much in particular, are going out and looking for wild plants that are suitable for their animals. And wild growing plants are not the same as what we get in Sainsbury's. What we get in Sainsbury's is tending to be higher water and higher sugar. In the wild, these plants are lower sugar, certainly lower water, and certainly higher fibre. So foraging has become really, really popular. There are a couple of good books out there by Twiggs Way, if anybody's interested in learning how to forage safely for your animals. So the sorts of plants that we suggest people go and look for are the really common ones. So dandelions and plantains. I foraged for these for my tortoises all the time. Things like vetch, raspberry, strawberry, bramble leaves, those types of things, chickweed, shepherd's purse. Anything like that is appropriate as long as you are confident in your identification of it. And if you're foraging, then actually drying those herbs or dehydrating them can also be a really, really good idea. You can buy commercial packs of dehydrated plants. You can go and do it yourself. It's relatively easy to manage. But as with all of these things, with feeding vegetables, we need to be a little bit careful with the calcium content, and certainly very, very careful with things like the oxalate content when we're starting to think about urolithiasis. So oxalate is in things like spinach. So spinach can be part of a balanced diet, but I would reduce it or avoid it in those animals that are prone to getting bladder stones. So water. very, very, very important for guinea pigs. And as we said, it can there can be very variable intake. Now, in contrast to rabbits, guinea pigs actually seem to do better with drinking bottles rather than open bowls. So actually what we do in hospital is we always provide both methods for drinking for guinea pigs. And again, it's worthwhile owners noting this, because actually with an open bowl, quite often, you know, you notice and you fill it up or what have you, but the drinkers, the teats can get, the nozzles can get quite messy from the guinea pigs, because they'll chew and there'll be a bit of food in their mouth and it'll get dirty. They can get clogged up quite easily. And quite often, many guinea pig cages do not have bottles that are a big enough volume, you know, when you see them being sold. So again, it's worthwhile highlighting that. And the importance of this is that certainly in sedentary guinea pigs, lack of water intake can predispose to urolithiasis, and it's a big problem. We see a lot of guinea pigs that have bladder stones or stones in the kidneys or in the urethra or the ureters. The lack of water certainly results in more concentrated urine, and as soon as we have the perfect storm of this with a diet that perhaps has too much calcium in it, then we are likely to have stones predisposed to form. And obviously it isn't that simple. It isn't that sort of nice linear relationship between lack of water and getting a bladder stone. There are other factors at play. And in my experience, the other factors, I totally agree with my colleague John Chitty. We see uroliths in indoor guinea pigs, and we should really be thinking about it in a similar way that we think about feline lower urinary tract disease. So it might be that fear of predation is a factor. If a guinea pig is hiding and doesn't feel comfortable to go out and urinate, so it's retaining urine for a long period of time. It can be competition for water resources. And if you have a pair or a group of guinea pigs, then I do advocate having several resources so that at least each animal has a chance to get equal access to the water as well as the food. And bullying can be quite a significant factor. So as I say, water intake is very worthwhile being able to discuss that with your owners, particularly if you have guinea pigs with urinary tract issues. So one of the other things, and again, I find owners ask this a lot, so that's why I wanted to mention it, is about food supplements. And increasingly now we are getting foods that are geared towards different life stages. And it's worthwhile sort of understanding what we are likely to see. So vitamin C, it is obviously you can supplement it over and above the pellets and the green food. In a healthy adult guinea pig, it is unlikely to be necessary. So I don't advocate putting it in the water because it's denatured very rapidly in water, and often it reduces the water intake of that animal anyway. You can get drops, and those can be fed directly to your guinea pig if it is necessary. And that tends to be the niggling, I'm not quite right, we're not sure what's wrong with the guinea pig, but it's not quite right. Then it might be worthwhile looking at that. But over supplementation with vitamin C can predispose to urolithiasis. So be wary of that and don't do it unless it's needed. Calcium and vitamin D. Now, we mentioned earlier that actually foods that are marketed and formulated for other pocket pets are not necessarily suitable for guinea pigs. And one of the reasons is that some of these have calcium levels and certainly vitamin D levels that are too high. And guinea pigs can be quite sensitive to these levels. So calcium and vitamin D supplementation in the normal course of events should not be required by most pet guinea pigs. Other things that we do quite commonly get added to food, and people certainly, where we have guinea pigs with stones, we certainly do use this clinically, are things like cranberry extract. So we know that cranberry extract stops the adhesion of bacteria to the bladder lining. So in guinea pig that has interstitial cystitis, this is a beneficial thing. We use it. I don't necessarily think we know a specific dose. It's it's a foodstuff. It's something that contains sugar. A lot of them use the sugar-free or the low-sugar cranberry juice and give some every day. And anecdotally, it seems to help and it seems to be safe. So again, it's certainly something to consider. Milk thistle is also something that a lot of guinea pig owners are talking about, and it's a herbal supplement that is used to support liver function and reverse liver toxicity. And certainly when we come to talk about obese guinea pigs and things like that, we do see fatty liver quite regularly. So it's certainly not a wrong thing to consider. Do we know a dose? Not necessarily. However, there are published doses for a lot of other species. And again, it seems to be safe and it seems to be helpful in appropriate cases. Other things that we might see are things like glucosamine, chondroitin, and polysulfated glycoaminoglycans. And these are all aimed at the older sort of question mark arthritic guinea pigs. And again, I think the research is a little bit equivocal on these. It helps in some iterations of arthritis and not in others. And certainly in dogs, there is quite a suggestion at the moment, certainly, that chondroitin and glucosamine are not as useful as we had previously thought. Certainly don't hurt, but do we know if they definitely help? I think that's that is up for debate. So what about pregnancy and lactation? One of the things that we do see quite regularly in guinea pigs is pregnancy toxemia. And it's not unusual to have somebody buy 2 guinea pigs, the gender check has been incorrect, and they've got a female that seems to be gaining weight, and oops, surprise, we've got babies. So it's actually not that uncommon. So what happens in pregnancy toxemia? This tends to be those females that actually are quite obese, and it occurs later on in the gestation. So from around day 60 or so into early lactation. So sort of the first week of lactation. And there are a combination of factors that are believed to be involved. But in the same way that we get milk fever in cattle, it is sort of the inability to meet the nutritional needs of the animal because of the size of the gravid uterus. And obviously, if you have a litter of 4 babies and you've got a primiferous sow, you can imagine that the size of the uterus is actually massive. These animals are stressed. They might be sort of stressed in the environment as well as the stress of pregnancy, and actually you just get a massively negative energy balance, and these animals do become both ketotic and acidotic. They're better at dealing with acidosis, perhaps in rabbits, but the ketosis can be quite a negative thing. And the liver at that point can't deal with the amount of circulating fatty acids and ketones, and fatty liver certainly is a significant risk. And these animals will die from the acidosis and the lack of liver function, as well as the negative energy balance. So what do we do for these sows? Well, we need to give them enough energy, enough dental attrition, and enough fibre, but perhaps in a lower volume. So this might be the case where we should be more reliant on pellets to get the energy into these females, while making certain that we're not giving them too much and predisposing them to gaining weight. It is certainly worthwhile controlling the energy intake in earlier if you get to these animals before they conceive, so that they're a good body weight at conception rather than obese at that stage. If you have a clinical case, the prognosis does tend to be poor. And we try and, do nutrient dense food. But sadly, a lot of these sows don't. Lactation, as I said, also a significant metabolic drain on the sow. However, she's able or more able to fit food into her body. And at this point, this is where it's worthwhile having in your armory a variety of favourite foods that you can offer. And again, a good quality pellets, probably those that are designed for a juvenile, really, rather than an adult. Older guinea pigs are, I would say, an increasing sector of the veterinary population at the moment. We're seeing guinea pigs that are certainly exceeding the 5 to 8 years relatively regularly now. And again, we have owners with much higher expectations. So in terms of guinea pigs and in terms of any animal, really, aging is a series of diagnoses, quite often diseases that are degenerative, quite often involving a reduction in organ function. And some of these you can support by manipulating the diet. So I think weight is one of the significant issues that we see. So both polar extremes, very fat animals and the animals where we can't keep enough weight on them. Obesity obviously can worsen things like heart disease. It can certainly impact on the joints and osteoarthritis. But the poor doers, those guinea pigs that are older, skinny little animals, actually may have a marginal vitamin C intake. Their dietary intake may not be enough to fulfill their requirements. So it is really worthwhile considering that. Increasingly, we are recognising kidney function and renal disease in older guinea pigs, and also in those that are of satin derivation as well. Guinea pig kidney disease can be difficult to diagnose, and what we tend to advocate is a combination of blood tests if it's safe to take them, but also ultrasonography of the kidney, so that you have an idea of what the renal architecture looks like. In terms of kidney function, what we need to provide for these animals is a really good protein profile, not a high protein diet, but an appropriate protein diet. And again, it comes back to having that core of good quality pellets for these animals, and also maintaining their water intake. So if they will take things like cucumber, this is absolutely the time to consider using it. Also, urothiasis, commoner in older guinea pigs. And again, water intake needs to be supported, as does an appropriate diet. So the diet does not want to be too high in vitamin C or too high in calcium. Neither does it want to be too low in calcium, because as soon as you get very low calcium, then we might lose a lot more minerals such as phosphorus in the urine. So we need to look at the diet and again, come back to having something very appropriate. Liver function, we've mentioned this earlier. So fatty liver can be seen quite commonly in older guinea pigs, particularly those that are obese or have been obese and then have stopped eating for some reason. And then osteoarthritis, we see this really, really commonly. And any guinea pig that's sort of over the age of 2-ish is likely to have osteoarthritis in at least one set of joints, if not all legs. And so again, it's something that's certainly potentially, because they can be quite sedentary, we may not realise is occurring until it's quite significant. So it is a welfare issue, I think, things that we don't recognise as a problem. And arthritis causes pain, it causes immobility, it can predispose to obesity, it can predispose to urothiasis. So it might well be that at this point we should be considering some of these supplements, and we certainly should be considering calorie restriction. Gut stasis. Now, we recognise this in guinea pigs in the same way that we do in chinchillas and to an extent dagus, but obviously similar to the rabbit. And as with all of these other species, just to highlight that it is a clinical sign and not a diagnosis. And it's common, any guinea pig that stops eating for any reason then will potentially develop gut stasis. In the same way that it does with any other species, gut stasis will cause fluid shifts, it will cause electrolyte imbalance, and it will cause acid-base imbalance. And these animals are, you know, they're a little bit more precarious, and we need to recognise that fact. And, you know, these are not the animal to put straight under anaesthetic for any reason unless you actually really have to. Gut stasis should be viewed as a welfare issue. It should be viewed as something that is seen urgently, and it certainly should be recognised as something that is painful. So these animals do need good pain relief. I very often, in using paracetamol and meropitant for these guys, and we're having very good success with those. All of these guys, as I say, gut stasis causes a shift in the fluid balance, and quite often they lose the fluid through the gut where they wouldn't ordinarily. So fluid therapy and supported feeding is imperative. And again, if you're supporting the feeding, then one of the proprietary products that contains vitamin C, for example, Recovery Plus, contains vitamin C, it contains pre and probiotics. That sort of thing should be fed to these guys as a priority, but to be careful, because guinea pigs sometimes will take a lot of food into their mouths and refuse to swallow it. So you can end up with a guinea pig with a mouth that is stuffed full of food that can't breathe very well. Prokinetics, so the use of drugs to stimulate the gut motility. Absolutely, we use the same drugs that we would for rabbits. So metoclopramide, cisapride, ranitidine and meropitant, also prokinetic, can be very useful. But to highlight that you actually need to diagnose what's causing it. It's all very well to get the guinea pig's guts going again, but it will relapse and relapse and relapse unless you find out what's going on. So hypovitaminosis C, I think the low subclinical hypervitaminosis is probably a lot more common than we think. And, you know, as I say, guinea pigs need between 10 and 30 milligrams per kilogram every day in order to be able to produce viable collagen, metabolize bile acids, and also metabolize dietary components such as amino acids and carbohydrates. As soon as an animal is deprived of vitamin C, if you have no vitamin C in the guinea pig diet, then you will get clinical signs in under 2 weeks. If you have a subclinical lack of vitamin C, obviously it takes somewhat longer. And these animals will present as weak. They may be off of their back legs. They may be showing signs of pain, like being hunched. They might be, you know, they're likely to be very lethargic. But in the as I say, the low grade insufficiency tends to be these guys that are getting the pneumonia for no good reason, or the acute enteritis or skin disease or something like that. So these guys perhaps that have mites, and you're wondering what is the cause of that. Again, have a look at the vitamin C content of the diet and how much diet they're taking in. On examination, what you might find is that it actually hurts those guinea pigs to be examined. It hurts to restrain them and it hurts to manipulate them. The joints may be swollen. You may have certainly quite a poor hair coat. You may have evidence of diarrhea. You might see hemorrhages on the gums. You might see ocular nasal discharge. All of these sorts of things are reported. And ideally, what you should do is to give some parenteral vitamin C in those places where it's available. And it should be part of your regime for any sick guinea pig. So I've mentioned bladder stones a few times, and again, we see these very commonly. The guinea pig is unlike the rabbit in that the rabbit takes in calcium indiscriminately and it usually excretes most of it through the kidney. The guinea pig is a little bit more controlled, so it will take in calcium related to the content in the diet, but mostly it's excreted through the gut rather than the kidney. As soon as we have very high levels of calcium in the diet, it is more likely to need to be excreted through the kidney as well. The commonest stones in guinea pigs are calcium-based ones. And the reason for this is obviously calcium to a degree is excreted through the kidney. And because the pH of herbivore urine is high, it's generally 8 or above, calcium salts are not very soluble in this type of urine, so they tend to precipitate out. So urine specific gravity can be a key factor in urolith production. The less the water intake, the higher the urine specific gravity, the more likely it is that you're going to get a stone. Diets containing hay tend to increase the urine volume because they increase the fluid intake. These guinea pigs will drink more. And it also slightly tends to reduce the urine pH. So that is another top tip. Absolutely push the hay in these animals where they're predisposed to urolithiasis. Fresh foods also increase urine volume. So don't forget the pellets. Don't take these guys off pellets completely because they're likely to need them to round out the diet. But again, be aware of how many pellets these animals are eating. And finally, dental disease. And again, we see dental disease, sadly, relatively regularly in guinea pigs. And in the same way as rabbits, they have teeth that have no true roots and that grow throughout lives. And this is a real adaptation to the environment that they live in. And it's, you know, we find that these animals that are so dependent on herbivory have significant evolutionary changes to their teeth. So similar to rabbits in that way. Incisors in guinea pigs grow very rapidly, so 55 to 100 millimeters per year. So that's actually, you know, quite a rapid rate of eruption. And you can imagine that as soon as you're not getting good wear for any reason, then we have a quite rapid issue. Guinea pig teeth are a lot more curved in the jaw, so certainly the upper incisors and the cheek teeth are a lot more curved than they are in rabbits, and this is part of the issue when we start to see problems with guinea pigs. In guinea pigs, the mandibular arcade is wider than the maxillary arcade, and they have a very, very efficient chewing mechanism. And the mechanism goes from side to side, as well as front to back, as well as up and down. And they move in those three orthogonal directions. And, you know, it sort of grinds everything down, and the occlusal angle is a little bit sort of offset compared to the rabbit. So they occlude at an angle of 30 degrees. And as soon as there is no attrition and there is no wear, we get a significant overgrowth and spur production a lot more rapidly than we necessarily would in a rabbit. So it's we have a problem. As soon as we have a guinea pig that is presenting with dental disease, there's a problem underlying. We do see occasional congenital dental disease, but primarily there is something else that is causing this. So whether it's traumatic, you know, there's been damage to the jaw, perhaps we've got an animal that has stopped eating because it's, you know, got pneumonia, perhaps the teeth are not well rooted because the collagen is not being produced normally that makes the periodontal ligaments, and we've got a vitamin C issue. And, you know, we really have an issue once we start to get very clinical disease in these guinea pigs. And one of the things that I find the most difficult is actually that a lot of these guinea pigs have temporomandibular joint subluxation. Generally is unilateral. and it happens as the cheek teeth malocclude, and it's often on the side that is opposite the mandibular incisor overgrowth. And these are difficult to get right, these guinea pigs, and they will require sort of ongoing interventions. So we have a picture here of 2 guinea pigs. The top one, sadly, that is how its jaw opens. It's not twisted because of the gags that are in. Its jaw was significantly out of line, and the x-ray showed quite a significant TMJ luxation in this animal. The guinea pig at the bottom, again, is likely to have something similar, and you can see that the mandible is certainly twisted towards its left-hand side. So with these guys, my feeling is that you only see maybe about a third of what's going on consciously, and guinea pigs are, you know, more difficult than rabbits because they quite often have a slurry of food in and around the mouth. So in order to do any kind of a conscious exam, you often need to sort of wash the mouth out carefully before you go and try and have a look. But in my opinion, I think you do need to do deep sedation at least for full examination, and certainly for any kind of sensible imaging. And, you know, quite often I know that we do sort of conscious dentals on horses or semi-conscious dentals on horses, but guinea pigs are small prey animals that are not skilled at running away. And I actually do think that things like restraint and manipulation can be very aversive for them. So I think the empathetic way to deal with dental disease really is certainly to provide anaesthesia. Just a word about the dental gags. We need to be very, very careful placing these in guinea pigs, even when they are asleep, because you can do quite significant iatrogenic damage to the soft tissues and the TMJ if they are used too aggressively. And, you know, I think difficult things can be explained quite simply, but as with rabbits, what you're looking to achieve with your dental intervention is some semblance of symmetry and some resemblance to normal physiological size and length of teeth. However, if you have very, very long clinical crowns, then it is wise to consider staging these dentals, because you take too much off, the dental intervention is too severe, then that animal will have difficulty closing its mouth. If it can't close its mouth, it can't chew and it won't eat, and it won't wear the teeth down, and you'll get spurs very, very rapidly. Again, it is worthwhile supplementing these guys with vitamin C or using a support feed that contains vitamin C. In terms of these animals, acquired dental disease is almost always secondary to something else, for example, respiratory disease, and that may be secondary to low vitamin C intake. So you need to explore and define and treat the underlying causes. But to manage everybody's expectations, so yours as well as the owners, quite often the second dental intervention is required within 2 to 4 weeks after the first. And, you know, if we don't deal with what's causing the issue and don't deal with the teeth well, then we're going to have a situation that's unsustainable financially and physically, as well as sort of ethically and emotionally for everybody involved. With all of these dental guinea pigs, it's worthwhile, after the intervention, absolutely needs to have very good analgesia and very good supportive care. So assist feeding until the animal is eating reliably, fluids, that kind of thing, just so that you know, we get a good or a better outcome. So to conclude, I think, you know, I genuinely think that guinea pigs deserve the same attention to detail that we give to other species. It isn't just a guinea pig, and we need to, you know, get the basics right. So a high fibre diet that is based around ad lib hay, some fresh greens that are appropriate, and good quality pellets, so that we have the vitamin C content, we have the mineral content, what have you. Remembering that these guys don't tolerate a high level of simple sugars in a diet, it can predispose to diabetes. So let's limit the fruit and the sweet treats, because guinea pigs will be very happy with anything else that they like to eat. So, you know, it's in our head that we need to give that. And remember that the vitamin C requirement is a key thing. And even these little subclinical insufficiencies can become clinically important to your patients. So at that point, I'm going to stop. And Claire, I'm going to invite any questions if anybody's still with us.
Okay, no, thanks so much for that, Molly. I think it's so true that guinea pigs need to be considered as just as important as their cat, dog and rabbit counterpart pets. So thank you very much for going through that. We have had a number of questions that have come through the chat and the Q&A. I'm going to start with the Q&A. So we've had a question here, and I think this participant has asked a number of questions. She's Lucy Tyne, and she has asked, how can we differentiate in a food package if it contains synthetic or natural vitamin C? I think that might perhaps be a question more for us.
Yes, yeah.
Yeah, well, to be honest with you, I'm not sure whether there is any legal requirement for a pet food manufacturer to state whether their vitamins are synthetic or natural. I would say certainly with the foods that we produce, we use synthetic vitamins. And the reason that we do that is that the vitamins are encapsulated to make sure that they will last to the correct levels that the pets need in their diet up until the best before date, so we don't get the degradation that you would perhaps get with the natural vitamin C content. But what I would say the best thing to do is perhaps contact your pet food manufacturer, who will be able to give you the information. So another question talking about fruit. Does that include non-typical fruit such as cucumber and tomato? I think you did touch on that, Molly.
So I think cucumber and tomato can be part of a balanced diet, as long as we recognise, you know, that they're not necessarily part of the big basis of the fibrous, you know, the fibrous portion. So as I said, cucumber if you need to increase the fluid intake, a little bit of tomato if your guinea pig likes it and can tolerate it. You know, but yes, we do need to be careful with these, because high up in the Andes, you know, they've not evolved to deal with that as efficiently perhaps as other species.
Sure, no, that's really interesting. And carrot tops, we always think about rabbits and carrots, and carrot tops are advocated for rabbits. Same for guinea pigs?
Yeah, you can use them in guinea pigs, but they do have the odd bit of oxalating. So again, as part of a balanced diet, yeah.
Yeah, sure. And broccoli, I don't think got a mention in the talk. Is that something that would be suitable?
Yeah, broccoli is suitable. Yeah.
Fantastic. So Helen Swift is asking about different cuts of hay. And then certain companies are selling first, second and third cut hays. Do you have any thoughts on that? Whether that's beneficial in the diet?
I think you know, if you look at guinea pigs in the wild, they're essentially going to have a bit of this each year, aren't they? You know, as the season changes, the availability changes. I've got to say, I wouldn't know enough about the first, second and third cut hay to be able to give a good answer to that. But I'll back that one back to you.
I think our view is, yeah, you get sort of different levels of nutrition and different levels of perhaps abrasiveness. And I think our view is always, you know, feed a really good quality hay, but make sure it's fresh, make sure it's not dusty, make sure it's not mouldy, and always feeding a variety of hay, I think is beneficial in the diet too. So we've also got a question here, whether it's beneficial to filter hard water to reduce the calcium content before giving it to guinea pigs.
I have a lot of owners that do that, or do provide bottled water. Yeah.
It's something
I
I
think,
do with my cat.
again, I mean, I'm not in a hard water area, luckily, but if you know, in London, potentially it would be sensible, so that at least you have control of it.
Yeah, yeah, absolutely. And brings us on to any tips for feeding guinea pigs with renal disease. I think you did touch on a few things like cranberry juice.
So that's more for sort of bladder issues. Again, this is where things like cucumber come in. And what you want is to get enough fluid through. You need to have, again, a good quality pellet so that you have an appropriate protein level. So you don't want too much protein, but you don't want these animals to be protein deficient either. So again, it is stimulating the appetite. So it goes back to sort of encouraging eating a wide variety of things, so that as soon as these animals are perhaps not eating as well, you've got a lot of options to try and tempt them with. And the other thing that I tend to do with these guys, urolithiasis and kidney disease, is that any fresh foods, wash them, don't dry them, feed them quite wet, so that every mouthful has water with it, so that we support the fluid intake that way.
Great. Talking about sort of fruit as treats, what is an appropriate amount to feed? I think you mentioned perhaps a raspberry a day, that kind of
yeah. I think what I'm trying to say really is that the guinea pig, the point for that animal is it's interacted with its owner. It doesn't care if it gets a piece of cucumber or a raspberry or a chocolate drop. It wants the interaction, and the provision of sweet treats is in our head. You know, it isn't in the guinea pig's head. So, and the interaction is the important
or, as you say, a piece of dandelion or something fresh and green is perhaps more appropriate.
Absolutely, absolutely. You know, it's just sort of shifting the mindset a little bit, because, and actually realizing as an owner how important you are to that animal, you know.
Yeah, sure. So this sounds like a veterinary question to me, and I'm going to try and pronounce the word correctly. What is the up-to-date amount of subcutaneous fluids to be given?
So we usually go with 100 mils per kilo over 24 hours, but we use hyaluronidase in our subcutaneous fluids. They dissipate rapidly and it does not hurt as much. And I'm being careful with giving a lot of fluids subcutaneously to guinea pigs, because they really, really hate subcutaneous injections. So if at all possible, I would advocate people try and get an IV catheter in. If you've got the animal anaesthetised for any reason, consider an IV catheter, consider an intraosseous catheter if you're needing a lot of fluids. And if that's not possible, then again, try and use the hyaluronidase, because the fluids, they hate injections, and you know, at least this makes that injection less painful, you know.
Sure.
So 100 mils per kilo over 24 hours is the short answer.
Okay, fantastic. And somebody's asking about resources for dental surgery, where they can learn a bit more, whether there's some courses and books.
Yeah, there are. There is a BSAVA dental, a BSAVA guinea pig manual in the works. So I would look out for that. I think that will be out, I would hope, within around a year. There are various dental books. So Estella Burma from Germany and Vittorio Capello both have veterinary dentistry books that are really, really good and cover guinea pigs very comprehensively. There's a fair amount in the most recent Casenberry book, which is Ferrets and Rabbits, Clinical Medicine and Surgery. So that certainly covers guinea pigs. There are a couple of websites started up with comments. Trinity Vets have one that
Oh, Molly, I think you're breaking up a bit there
as well.
I think you broke up a little bit there, Molly. I don't know if that was my connection or your connection.
Mhm. Did you hear the answers, or?
I think perhaps that's something we can pull some information for people, because there will be a recording of this and we can answer any questions that don't get answered after the event. Probably the best thing is to email Supreme Pet Foods, and the best email is experts@supremepetfoods.com. So if anything doesn't get answered, please do get in touch. Somebody's asking about varieties of hay and what's a good variety to feed to guinea pigs. Personally, my point of view, we like Timothy hay for guinea pigs. It has good sort of protein fibre content. It's low in calcium, and yeah, it has good nutritional profile for guinea pigs. That would be our personal recommendation. And also asking about what would be the appropriate amount of pellets to feed in a diet, and you say a small portion. From our point of view, we would say that we would always recommend for people to follow the feeding guides on the pack. That's really important, because different pellets can vary in the bulk density. So some portions can look bigger and some portions can look smaller and still have the same amount of nutritional content. So it's really important. If you look on pack, it will generally say to you to weigh the guinea pig, to find out the weight of the guinea pig, and then feed a certain amount per kilo of body weight per day. So yeah, that's good advice. Someone is asking, how long do you find it takes for a hypovitaminosis to recover clinically?
I think it depends to an extent how severe it is and how rapidly it's started. But with these sort of fairly chronic ones, again, I find that as long as we get the diet right, we're looking at 2 to 4 weeks. With some of the very severe issues where they've gone off their back legs, for example, then that can be significantly longer.
Okay. Supplementing omega-3 fatty acids, does it need to be of vegetable origin, or can you use fish oil, for example?
I think they are herbivores, so it depends, I think, on your owner, because I have a lot of owners that would absolutely say it has to be of vegetable origin and will not countenance anything else. And again, it depends on your point of view whether it's appropriate to give them something that they wouldn't ordinarily have in their diet. So I've got to say, I would lean towards a vegetable origin one as well, to be fair.
Yeah, sure. What do you think about willow tunnels for chewing? Good idea?
Yeah, oh, they love them. Yeah,
fantastic.
Absolutely.
Someone's asking about drugs for sedation in guinea pigs and what you would recommend.
So we usually, we generally do a pre-med and then we use a gas for induction. So we pre-medicate so that the animal is not scared. So I quite commonly use midazolam and buprenorphine. If you want specific doses, I'll put that in an email. I think this is not something to listen to sort of verbally particularly, so that we don't sort of get any misunderstandings. And as I say, we usually use a gaseous induction and other pain relief as appropriate at that point. But I wouldn't use wholly injectable without any gas, typically.
Okay. And going on to talk about nutrition again, what would you ever suggest limiting the amount of fresh grass intake a guinea pig should have?
Not necessarily. No, I mean, we have a lot of animals that are kept outside and graze all of the time. If there's a weight issue, potentially you might want to limit the access to all types of food. But if you think about in the wild, dependent on the time of year, these animals do graze, you know.
Yeah. So another question here from Jules Morgan Rogers. Is there anything dietary that we can do to reduce impaction in a 3-year-old male?
definitely make certain that the fibre is on point and high enough, and make certain that that animal isn't obese. But the difficulty with that is the lack of is a reduction in testosterone and the increase in secretions in the cloaca, and there's not a lot dietarily that you can do to alter those two things. So as long as you've got the fibre content and the animal isn't overweight, that's probably as good as you can do for that specific condition.
Sure. Okay. And obviously talking about the fresh leafy greens that we've suggested that they should have in their daily diets, what's a sensible quantity? I mean, we generally tend to rule of thumb, say, a small handful.
Yes.
Would you say that's about right?
I think that's exactly what I say. So, I think we have it, I suppose, a little bit less defined, don't we, with guinea pigs than we perhaps do with rabbits. But if you look back on your Pet Food Manufacturing Organisation website, they have actually a similar poster to the rabbit one with saying that exact same thing, which is a small handful.
Yeah, fantastic. How do we get owners to move away from wood shavings as bedding? Is that something that you try to advise your clients?
Yes, absolutely. I because the reason, we get a lot of guinea pigs with these chronic respiratory issues, and I think, wood shavings certainly don't help with that. I don't think they're very good for the feet. We see a lot of guinea pigs with bumblefoot, and again, it's a nightmare. So I absolutely try and get owners, if their guinea pigs are indoors, to have them with hay boxes and things like that, and something different as the substrate on the floor. And if they're outside, then plenty of hay inside the hutch and then outdoor space. And in my head, I don't think there's a lot of room for the wood shavings, really. Again, they're sort of perpetuated from keeping animals in the 1960s, that really.
Yeah, absolutely. So yeah, again, a veterinary question, so excuse my pronunciation if it's incorrect. What dose maropitant would you use, and would you repeat if needed?
Same dose as a cat. So until we have better information, we're using a cat dose that's titrated down per kilo. And yes, I do repeat it. And yes, I do send guinea pigs home on maropitant crushed in water or syrup. And I tend to give it twice a day in guinea pigs. And it's very, very good for abdominal visceral pain. And it's also good for promoting gut motility, or it seems to be.
Okay, and somebody asking about paracetamol dosages as well.
Again, we're using a very anecdotal dose, and it's relatively low, so it's about 10 milligrams per kilogram, and it seems to work for those animals with bellyache, and it seems to work for very intracranial pain as well.
Okay. We've got somebody here, Jade, who is a shop owner and owner of over 100 guinea pigs. Is after a list of resources and advice. So I guess, for new pet owners, well, that's definitely something that we can help with in terms of some of the leaflets and literature that we produced.
Yeah.
Can indoor guinea pigs live on vet bed?
Yeah, they can certainly have vet bed as long as they've got access to hay and things. And quite often, obviously, keeping guinea pigs indoors is a compromise, and I try and get owners to give them a variety of things to walk and stand on, because that tends to reduce the amount of bumblefoot that we see. So vet bed, perfectly appropriate. It's soft, it's absorbent, water wicks away, but have a variety of substrates.
Yeah, sure. So another question, vegetables like carrots, beetroot and corn, would you feed these regularly, or are they more comparable to fruits and should be treats only?
I would tend to have those as treats only. So guinea pigs, just like rabbits, they wouldn't dig for a carrot. So they're not something that they would ordinarily have in their diet. And same with corn, it wouldn't be a sort of a high proportion, although you have to argue that potentially, you know, corn is a crop, or maize would be a crop in South America, so they might have access to it to a degree. But I tend to feel like it's high in starch and it's high in sugar.
Okay.
A little bit is fine, but loads probably not.
Yeah, it always makes me feel very uncomfortable when I see those large dried corn on the cobs in pet stores. And yes, certainly there are much more healthy treats that can be fed to these animals that are high in fibre without the sugar, perhaps more appropriate towards what their natural diets would be. Well, we're approaching the hour and a half mark, Molly, so I think it would make sense to start to wrap up here. I would very much like to thank you once again for your support and your knowledge, and for helping sharing this with all these people, all these wonderful people who've joined us today to find out more about guinea pigs and guinea pig nutrition. We will have a recording of this webinar available after the event, so please watch out for that. We will email you all and let you know. And if anyone has any questions they haven't had answered today, then please do contact experts at supremepetfoods.com. Thanks very much, guys. Thank you, Molly. Thanks, Julie. And we look forward to seeing you all on our next webinar. We will let you know when that's going to be. Thank you.